This video will cover general renal assessment, which includes health status, history, and physical exam. Before we start, be sure to download the free PDF study guide with this video to enhance your learning. Link is listed below. Importance of the assessment. A good assessment allows us to gather important information that serves as clues as to what is going on with the patient. Once we have enough information, treatments can begin. Assessments also allow us to re-evaluate current treatment or past treatment to determine whether the treatment is helping the patient or not. Current health status. It's important to document the reason the patient is seeing the doctor and their complaints. Common complaints for renal disorders are pain, change in frequency and urgency, and difficulty urinating. Previous health status. Ask about the patient's previous major illnesses, recurrent illnesses, accidents or injuries. You should also ask about surgical procedures and allergies, as these could also be clues to possible causes. Sometimes the patient may not remember or understand how to explain certain issues, so it's also good to ask specific questions like, do you have pain or burning on urination? Is initiating urination difficult? What color is your urine? Family history. It is important to ask if there is a family history of cardiovascular disorders, cancer, or other chronic diseases. Physical examination. The first step begins with obtaining vital signs and weighing the patient. During this time, you may also collect a urine specimen as well. In the previous video, we learned that the renal system affects many body functions, so a head-to-toe assessment would be done. Inspection. When focusing on the renal system, inspection includes the abdomen and urethral meatus. While inspecting the abdomen, you look for abnormalities, which include enlargement or fullness while comparing both sides. A normal abdomen is symmetrical. Ask about scars, lesions, or bruises if they are seen. Auscultation. During auscultation, you will listen to the renal arteries for any abnormalities, such as systolic bruits, which have a whoosh sound. Percussion. Here you will gently tap on the kidneys to note any tenderness or pain, which is an abnormality. Also, percuss the bladder to note the position of the bladder. Palpation. During this examination, the kidney and the bladder would be palpated. Here you would be able to notice any lumps, masses, or tenderness. Encourage the patient to relax as much as possible by taking deep breaths through the mouth. Fluid and electrolyte imbalances. Patients with kidney disorders will commonly experience fluid and electrolyte imbalance. Knowing this will be very helpful in your exams because signs and symptoms will indicate certain electrolyte imbalances. Fluid imbalance. Fluid is a very big indicator when it comes to renal disorders. There will be fluid overload, which means the patient has too many fluids for the kidney to handle, and fluid volume deficit, which means the patient doesn't have enough fluid in the body. Now, what's very important to remember is that fluid and blood pressure have a strong relationship, so careful monitoring of fluid is crucial. The most accurate indicator of fluid loss or gain is weight gain. The three most important imbalances we're going to go over: fluid volume, sodium, and potassium. Fluid volume deficit. These manifestations include decreased skin turgor, dry mucous membranes, oliguria or anuria. Fluid volume excess. These manifestations include edema, crackles, shortness of breath. Sodium deficit. These manifestations include nausea, tiredness, lethargy, headache. sodium excess. This would include the patient complaining of thirst, rough dry tongue and fever. Potassium deficit. These manifestations include abdominal distension, paralytic ileus, and ECG changes. Potassium excess. Manifestations include diarrhea, nausea, irritability. Interventions. When manifestations are present, there are nursing interventions we take to help improve the patient's condition, which we will talk about later when discussing treatments. Well, that concludes this video. Join us in the next video as we cover Diagnostic Test Part 1 of the renal system. Thanks for watching.